Welcome to the Town Hall. Welcome to the Town Hall. We will begin momentarily, and please note this meeting is being recorded. Hello and good afternoon. It's my distinct pleasure to welcome you all to our COVID-19 virtual community Town Hall. During this Zoom call, you will receive the latest and greatest updates and facts on managing the pandemic here in Santa Cruz County from a trio of healthcare and community health experts. My name is Drew Gagner, the Vice President and Chief Philanthropy Officer of the Dominican Hospital Foundation, and it will be my pleasure to serve as the moderator of this virtual town hall. During our time together, you will hear from Dr. Gail Newell, the Health Officer for the Santa Cruz County Health Services Agency, Dr. Nanette Mikowitz, President and CEO of Dominican Hospital, and Dr. Greg Whitley, the Chief Medical Officer of the Dominican Hospital. The topics to be covered today are COVID-19 trends, nationally, statewide, and locally, the ways in which the Health Services Agency and Dominican Hospital address the pandemic in Santa Cruz County, how to protect yourself from COVID-19 and what to do if you or a loved one develop symptoms, and the impacts of the coming flu season and the difference between the flu and COVID-19. During the presentations, please feel free to post your questions utilizing the Q&A feature on the bottom of your screen. We will monitor those questions and get to as many of them as possible on the backside of these three presentations. If you'd like, please also include who specifically you want to answer your question. Now let's get started. Dr. Gail Newell has served as Health Officer for the County of Santa Cruz since July 2019. She attended UC Berkeley for undergraduate work and UC Irvine for medical school before returning home to Central California to the UC San Francisco Fresno OBGYN residency program. Her strong interest in public health led her back to UC Berkeley for her Master in Public Health degree with an emphasis on maternal child health. Dr. Newell worked in clinical practice in a variety of settings for over 30 years. She served as Fresno County's Medical Director at the Department of Public Health, then as Health Officer in San Bernardino County. Dr. Newell's areas of special interest include public policy and advocacy for health equity, family health, opioid use disorder, reproductive rights, breastfeeding, and LGBTQ healthcare. She looks forward to putting down even deeper roots and working together for a healthier Santa Cruz County. Ladies and gentlemen, Gail Newell.
Well, thank you for this opportunity to join you today through Dominican Foundation. Dominican and Dignity have been fantastic partners during this entire pandemic, and I couldn't have done it without you, quite literally. We couldn't do it, this community, without you in our community. So thank you so much for your ongoing community service and partnership. So we're going to all talk together about how to manage this pandemic in Santa Cruz County, where we've been and where we're going. And I made these slides last week. A lot has changed in the last few days, and I'll tell you about that moving forward here. So next slide. So here's a view of what's happening in the world. It's actually astonishing. When I started following this website from Johns Hopkins in January, I was counting individual cases in countries around the world. And I remember getting excited in a negative way about when the US had our first 10 cases. And here we are now at over 10 million, expected to be 11 million by the end of this week. And we've had worldwide well over 1 million deaths, 1.3 million now across the world, 250,000 in the United States. And you can see this map, the red map is where cases are most pronounced, how many cases we have, and you can see there that the United States is markedly red. So next slide, how did we get here? Well, this is how it happens. So it only takes one person spreading the virus with another person On average, a case spreads to 2.4 other people, somewhere between 2 and 5 other people, if we don't do anything at all to prevent it. If we're wearing our face coverings and are practicing our social distance, that can be as few as 1 to 1. But even in the 1 to 1, look at how this spreads. So every 5 days, there's a new generation here. With 6 generations, every one of those dots is a new case in a month. Next slide. So here in California, we have done relatively well. Some of the best numbers in the United States and some of the best numbers in the world. And in Santa Cruz County, we have done relatively well compared to the rest of the state. And besides an early shelter-in-place order here, I attribute that to the community and our willingness to do the right thing and think about other people in our community and take action as an individual by following those social distancing requirements. And next slide. So let me talk a bit about California's blueprint for a safer economy. That's the statewide plan that the governor has set to tighten and loosen restrictions on activities. And there's 3 different areas that the governor and the California Department of Public Health look at to assign our tier. And here's where the big news is today. So next slide. The governor has always said that he would apply emergency brake, as he puts it, to this tier system when he felt that it was an emergency. So today, most of the state, the governor just announced at noon, became purple. And we are one of those purple counties as of noon today. So this is probably news to a lot of you on the call. It was news to me on Friday when I began to hear that this was being considered, and I was in conference calls with state leadership over the weekend. And the governor announced today that most of the state would be purple. There's a few counties that are red. But if you look at the governor's website today, you'll see that we have landed, as have most counties, in this widespread disease area with more than 7 cases. Remember that just a week ago, we were still orange. We had been orange for 2 weeks with a moderate spread, and we earned that legitimately. But like the rest of the nation and now most of the state, our cases have skyrocketed in a surge, a huge spike. And we definitely meet the metrics. We're well into the purple tier. It shows there the case rate is more than 7 cases per day per 100,000. And we actually have reached 13 cases per day. And just 2 weeks ago, we were down in below 4. So a big change. The surge has definitely hit us here locally. Besides the case rate, the governor also looks at our positivity rate. So of 100 tests that are done, how many of those became positive? And I'm going to tell you that at Salud para la Gente in their respiratory clinic on Saturday, they tested 100 people, 44 were positive. That's in a cluster. It's a symptomatic population of people, so we would expect it to be high, but anything more than 8% positivity is purple. And then we also look at the health equity in our most socioeconomically vulnerable populations. So let's take a look at that. Next slide. So this was the slide of California this morning. It switched at noon, so I didn't have time to update my slides. But when you look at the governor's website, and for those of you that aren't familiar with it, it's covid19.ca.gov. You will find this map. There's also a link to this map on our website locally at santacruzhealth.org. And you will see that almost the entire state has turned purple. I noticed quickly looking today that our neighbors San Mateo, San Francisco, and Marin are still red. That has a lot to do, not so much with a better case rate than ours, but markedly more testing. And so the case rate is adjusted down. So let's look at Santa Cruz last week. Next slide. Specifically, and you can click on that map, it's interactive, and see what the numbers are for Santa Cruz County. And last week, our case rate was 6.9. And remember, today it's 12.9. Last week, it was adjusted down because of our testing to 5.9, this week to 11.9. Our positivity rate has risen into the 3s, and our health equity positivity rate is even higher. Next slide. So why do we have a health equity metric? It's because with COVID-19, from the very beginning, our populations, our communities of color have been the hardest hit. And I want to make it clear that this is not because they are genetically more vulnerable to COVID-19, or for some reason in their health profiles that they have more vulnerability to COVID-19. In some cases, that might be overall correct with the health profiles, because we know things like heart disease and diabetes and obesity or overweight may put people at greater risk of transmitting, or of becoming infected and getting sicker once infected. But overall, it's because our communities of color are generally our frontline workers. They're exposed more often. They live in more crowded housing and have less of a safety net to hold them up when they do get infected. So we're working to reduce disease transmission in all communities, but especially the communities most at risk. Next slide. So we're probably not surprised when we look at where the state has determined our most vulnerable populations, but they're down here in Watsonville area. And then there's some up in Santa Cruz as well. And the way the state determines this is it uses a measure called the Healthy Places Index. And it's a measure of our socioeconomic success or standing, including specific health outcomes, but more around median household income, housing insecurity, food insecurity, environment, the factors that you see listed here on this slide. And next slide. So this is specific to our health equity measure around testing positivity. And you can see that indeed it includes most of the city of Watsonville and the areas to the east of Watsonville, the rural Watsonville areas. But you can also see that there's two other areas in Santa Cruz proper. One is in Live Oak and the other is in Beach Flats. And those are the areas where we've been focusing most of our resources and our efforts on our COVID response and prevention responses. Next slide. So we've done pretty well. You can see our case curve in green there compared to other counties in California. The very top one is Imperial. They have struggled all along because they have a very active border with lots of movement back and forth between Mexico and California. Kings County has struggled with skilled nursing facility outbreaks, as well as some meat packing plant outbreaks. But the rest of the counties were pretty well clustered in there with the Bay Area, actually significant lower than most of them. So again, I give great kudos to our community. And next slide. I hope you're familiar with our website at santacruzhealth.org. I'm not going to go over these slides in detail, but if you go to that website, you'll find all of our data, and it's updated on a daily basis. And you can see all of the numbers tick upwards as we go. And what I want to point out on this slide is that if you look at the bar graph, the aqua bars, you see a definite spike in the last little bit here and a definite increase in the curve. So When we talked about flattening the curve, this is the opposite of that. This curve is the steepest that we've seen. Next slide. As we have seen since the beginning, our known cases are most in the 20 to 34 year age group, although this is evened out somewhat. We're seeing many more cases reported in the pediatric age group now. All along, even though our Latinx population only makes up 1/3 of our county population, they've been close to 2/3 of the impacted folks who are getting COVID. Next slide. And if you look, this is an interactive map. So when you move your cursor over it, when you go to the live website, you will see that South County is much more impacted than North or Mid County. And also Watsonville in that area more impacted than anywhere else. The next slide. We show that again on our equity page, and you can see that the little vertical lines are where we would expect the bar to land based on proportion of population. So for example, the bottom right quadrant, South County, there's only 29% of our population that lives in South County, and yet 62% of our cases are in the South County. Same with our Latinx population, same with that 20 to 34 year age group. And next slide. Here's a graph demonstration of our increase, our recent increase. There you can see a 49% increase. If we graphed it out another week, you would see a 100% plus change, so a more than doubling in our case rate. It's interesting when you look at our spikes here, that most of the spikes can be attributed to some event or another in the county. I think most of them are related to holidays back here in June after Labor Day, after July 4th, after the fire outbreak, and then Labor Day. I meant Memorial Day at the beginning. Memorial Day, 4th of July, the fires, Labor Day, Halloween, each of them has been followed by a significant spike. And we know that the mixing that happens with those events, about 2 to 3 weeks later, we're going to see cases rise, the case rates, and then hospitalizations, and then deaths. Next slide. So hospitalizations, we've gotten better as a country, a state, and a community at preventing death. So our deaths, even though our cases are going up, have stayed relatively low. And our hospitalization rates have stayed relatively stable over the last 2 months. This may change as our case rates increase and we're experiencing a surge. The report I got from the Santa Clara health officer today is that their hospitals are almost all near capacity. Next slide. This is something called a reproductive number, and I promise you I'm almost done with graphs, but this is a very important one. We want to be down in the green. So if you remember that graph, that second slide in of the 6 generations of one person expanding into many people over a month period of time, this tracks our reproductive number. For each person who's infected, how many more people are they infecting? And right now it's in the yellow, more than 1, and we want to see that stay close to 1. So our community, I hope, will continue to do well and keep this down close to 1. Next slide. What about the good news? Well, last week, Pfizer announced that they have a 90% effective vaccine, and we may be getting that as early as December. And then Moderna announced that over the weekend as well. So we've got 2 companies now who are vying to very soon put out vaccine. But the next slide. The first doses of vaccines will be for those who work directly with the COVID positive patients. So our workers, our healthcare workers in skilled nursing facilities, in our emergency departments, our ICUs, our COVID wards, and the first responders who transport those. Those are first in line to be offered the vaccine. Next slide. After that, it will be those who are in long-term care in our skilled nursing facilities, our assisted living facilities, our essential workers, those who are vulnerable based on their race, ethnicity, disabilities, rural populations, those who are incarcerated or otherwise detained. Next slide. So what we're doing from a public health point of view is monitoring the vaccine trials closely, getting ready for distribution. There's experts at both the federal and state level who are working on ensuring that the vaccines are both safe and effective. And next slide. And other sets of experts who are working to determine guidelines to prioritize and allocate the vaccine supplies. And they include experts in many areas. Next slide. So a reminder to everyone in the audience that your simple acts make a big difference for COVID-19 and the flu, because on top of everything else, it's flu season. So remember to wear a face covering. And the governor has just issued a stricter face covering guidance today, along with his press conference. Remember to maintain 6 feet of distance from others outside of your household. Wash your hands frequently, minimize mixing, especially with Thanksgiving coming up, and get your flu shot if you haven't already. Next slide. Remember that there's correct ways to wear your mask and incorrect. And if you wear your mask incorrectly, next slide. A reminder that this is what happens. So back to that unmasked, unprotected spread of disease through our community. And last slide is that reminder that your action, our actions together, save lives in our own community, in our state, and across our nation. So I will be available for questions later on in the program, and thank you for letting me kick it off.
Dr. Newell, thank you very much. That was very, very informative. As 2 reminders, there are a series of questions that are queuing up. We're going to hold those till the end of the program. We're going to do our very level best to get to as many of them as we can. The second reminder is that this is being recorded, and we will make sure that it's available to the public for you to share and also to review both the slides and the content. Now it gives me great pleasure to introduce both Dr. Nanette Mikowitz and Dr. Greg Whitley. Dr. Mikowitz has served as President and CEO of Dominican Hospital since November 2006. She's been a member of the medical staff at the hospital for 26 years with specialties in infectious diseases and internal medicine. Immediately prior to her role as president, Dr. Mikowitz served as chief medical officer of the hospital, all while maintaining a medical practice in infectious diseases. Dr. Mikowitz earned her undergraduate degree in biology from St. Mary's College in Moraga and went on to study medicine in Chicago. She fulfilled her residency at Cedars-Sinai Medical Center in Los Angeles, where she also served as chief resident, and completed a fellowship in infectious diseases prior to beginning her practice here in Santa Cruz. Aside from her significant professional obligations, Dr. Mikowitz is deeply involved with the civic and philanthropic affairs of Santa Cruz County, among them the Executive Committee of the Health Improvement Partnership Council, whose purpose is to identify and resolve important healthcare issues locally and to improve healthcare for the uninsured, underinsured, and publicly insured. She has served as co-chair of the United Way of Santa Cruz County campaign and co-chair of Second Harvest Food Bank Holiday Food and Fund Drive. And now for Dr. Whitley. Dr. Greg Whitley is an emergency medicine specialist, Dominican Hospital's chief medical officer in 2019. During his nearly 20 years here at Dominican, he has also served as chief of staff, vice chief, and secretary treasurer of the medical staff. He has also served as the medical director of Dominican's emergency department for 10 years. Dr. Whitley was born in Burbank and grew up in Palos Verdes. He earned his bachelor's degree in history from Dartmouth College and his medical degree from UCLA. Dr. Whitley completed his internship in internal medicine and residency in emergency medicine at UCLA Medical Center and a sports medicine fellowship at San Jose Medical Center. He was, in fact, the San Jose Sharks team physician for the first 15 years of his career. Before joining the Dominican family, Dr. Whitley worked in the emergency department at Los Gatos Community Hospital, Stanford University Medical Center, and Valley Medical Center. Dr. Whitley, Dr. Mikowitz, it's yours.
Thank you. Thank you so much. Why don't I start by telling you a little bit about Dominican. We'll go to the next slide. So as you know, for the last nearly 80 years, Dominican has been caring for the community of Santa Cruz. Here's some of our details. We are accredited not-for-profit hospital. We've worked for many generations to take care of the Santa Cruz County community residents. But we're not just a regular small community hospital. We have expert heart and vascular teams. We have comprehensive cancer center. We have a total joint replacement program. We also have a baby-friendly designated birth center, and of course our level 3 neonatal intensive care unit. And I think very importantly, we're very blessed to have about 1,800 employees and 560 physicians on staff. I would want to not go much further without thanking Gail, Dr. Newell, for her support during this time frame. I feel like we have 1,801 team members with Dr. Newell helping us out throughout this pandemic. Next slide. The work that we've done has been recognized by many different organizations. I'm very excited that in 2020, we were noted in Newsweek as a best maternity care hospital. We have a long-standing history of outstanding results in coronary intervention procedures as well as neurosurgical procedures. We did achieve a leapfrog group A grade for patient safety. And there's a list of other get with the guidelines that we have achieved year over year with our commitment to quality. Go to the next slide, please. So how did COVID-19 impact us? Well, as Drew mentioned, I am an infectious disease physician by background, and I will say that living through and caring for patients during a pandemic is my own personal nightmare. I was hopeful that I would not have to deal with this since I wasn't in practice in 1918. However, back in March, we, like everyone, we didn't really 100% know what we were dealing with. The virus hadn't hit us hard at first. And so we watched carefully and we prepared, and we watched Seattle and New York and other countries like Italy. And we realized we had to put significant effort into our surge preparations. Luckily, we had procured a lot of PPE, and in fact, with community support, we had a plethora of different PPE types. Early on, like most hospitals in the country, we paused our elective surgeries and we trained up staff members in the event of a surge. But our goal was always to provide the best possible care for all of our patients, not just the COVID-19 patients, and to make sure that our employees were safe as well as our physicians. We are very fortunate that Dr. Newell did issue a swift shelter-in-place order. I know that wasn't easy for her, but it definitely made a significant impact in slowing the spread. And we have thus far avoided the kind of surge that others have experienced. Next slide. It's important to remember to laugh. Off and on throughout this pandemic, my team members have reminded me to pause, to breathe. I don't know about you guys, but our families have been working and studying from home, and it's always exciting when we get home. They want to know what happened in the outside world. And now I have something in common with my dog, getting excited when people come to the house or go past the house. Next slide. Decision-making of pausing elective procedures was not without impact. And the New England Journal of Medicine reported out that the delays in care that occurred because one, people were fearful to come to the hospital, two, that they couldn't have elective procedures that typically would be screening for things like cancer. And then three, outpatient care. People weren't feeling comfortable going to doctor's offices, or the doctor's offices weren't open. And so there was potential harm to people who avoided the hospital. So I wanted to just share in the next slide some of the things we've taken on to make sure that people are safe when they come here. We're always worried about keeping our patients and employees safe. From the beginning, we adhere to the guidance from CDC and CDPH. Dr. Newell meets with the 4 infectious disease doctors nearly every day since pretty much the beginning of the pandemic to problem solve and to work with us to keep everyone safe. Early on, we said no visitors. Then we had some visitors, and I have a slide later about where we're going with that. Those who work with us, our doctors, our patients, our employees, visitors are all screened upon entry to the hospital. We require that they wear a mask and we provide masks to everyone. We ask everyone to follow social distancing guidelines. Early on, we had a little challenge keeping track of our sanitizing gels because they would disappear. And so I'm happy to report that we have procured plenty. And so we're using enhanced cleaning and disinfection protocols, not just for our rooms and such, but also as we go forward and have people come to the hospital. We were very lucky early on to work with the county on getting testing for our patients pre-procedure. And now we have procured several different testing modalities here at the hospital that provide very rapid test results. We have been separating our patients, our COVID-19 patients, and I know it's an inconvenience, but we have closed all but 3 entrances into the hospital, and we appreciate everyone's patience as we redirect you. And of course, we're very lucky that our physicians in the Dignity Health Med Foundation and also throughout the community adopted and adapted quickly to telehealth care. This was the incentive to get that going. Next slide. We don't practice and take care of people in a vacuum. We've had incredible collaboration across the local healthcare and county. We've had PPE that's been shared as part of Common Spirit Health. We've had access to things that maybe other health systems have struggled with. Not only PPE, but also best practices and sharing. We've had other resources in the event that this organization needed something, we could call upon one of our sister hospitals to provide that. And I think the sharing of best practices and resources with our local healthcare partners has been amazing. Our Palo Alto Medical Foundation doctors, our Dignity Health Medical Foundation doctors, the Safety Net clinics, and others have all stepped up to work in collaboration to make sure that our patients are treated quickly and appropriately. I'm actually very proud and probably a little slightly snarky about it, but good for our county health for getting us medication so quickly. I mean, they got us remdesivir early and they keep providing us with things. And I kind of talk about it to my colleagues in other counties about how lucky I am to work in a community where the public health is really focused on collaborating with hospitals and healthcare providers. So in a good way, I brag in a good way about our health department. Next slide. So our current visitor policy is in flux. In fact, we were enjoying being orange and started to include more visitors to our organization. And then at noon today, we have the announcement that we've moved to purple tier. So we are going to reevaluate our visitor policy accordingly. Remember, our main goal is patient and employee safety. And so please check our website and social media pages before you come visit us so that you're not disappointed in the event that we have to be more stringent. There are some specific exceptions to the visitor policy to assure that end-of-life patients and people who need that support real time have an opportunity to help their loved one. But at this point, please stay tuned and more will be coming. Next slide. So I just want to end the next few slides in a very grateful manner. We've had phenomenal community support. When we first put out to our physicians and our dentists, all healthcare providers that, you know, we wanted to start getting more PPE donations, we were inundated. You know, community members stepped up and made face shields. They They've been bringing us meals. They have provided the posters and letters of support. And the letters of support are incredibly meaningful to our hardworking staff. We had the National Guard flyover, which was very exciting and noisy. And of course, we had the opportunity to thank our first responders. So that was really a great experience for us. Next slide. This is just some examples of the wonderful letters and support that we're receiving. I have to say it warms my heart as I walk through the hospital, and as I walk out the door, there's one very lovely note that someone wrote us, and it does make a big difference, and it lifts our spirits in these difficult times. Next slide. And then, of course, I wanted to take this opportunity once again to thank our anonymous donor who saw our wonderful employees working hard. They're standing up and staying up. I love her language, taking care of the community. And so this was recognized throughout the nation for the generous work that this donor did for us. And we really are grateful for that. Next slide. So I want to turn this over to Dr. Whitley. I love this slide. I do believe that our physicians, our staff members, nurses, RTs, everyone, and I'm sure I will forget, so I'm going to stop there. And everyone who takes care of patients and keeps this hospital humming is a superhero, but Dr. Whitley for sure is a superhero. I'll turn it to him now.
Thank you, Nan. I'm not sure that's true, but good afternoon, everybody. Thanks for showing up. Next slide. I'm going to talk a little bit about the things to do to help protect ourselves in COVID. This is my favorite slide of all time, I think. This is a friendly patient showing you the wrong ways and the right way to wear a mask. Everybody's required to wear a mask in public spaces, and you need to make sure you cover your nose and your mouth, as this patient is doing. Next slide. So to prevent the spread of infections, you know, it's a scary virus, but we know that what we do can actually prevent the spread of this virus. Dr. Newell said it before, but stay home, minimize your mixing. When you're washing your hands, do it for 20 seconds at least. Sing happy birthday twice. That's a good way to remember it. Social distancing is really important, a 6 foot distance between yourself and others who are sick. And cover your nose and mouth with a mask, but not around other people. And especially, you know, you might not know for the first 3 to 5 days that you have COVID, and you can be really infectious during that time. That's why masking is so important. Clean and disinfect, frequently touch surfaces every day, tables, doorknobs, light switches, etc. And monitor your health daily. One of those tricky things about COVID, again, is you might have symptoms before you know that you're sick. Or when you just start to get sick. And I think a lot of us in the community are used to going to work when we're a little bit sick. And we've noticed that there's often, you know, one person who came to work with a cough or a stuffy nose or a low-grade fever, and they thought, I don't have COVID. I've gone to work like this before. But it's really important with COVID not to go to work if you're sick. It's hard to remember with all those healthcare heroes out there who are used to working a little bit under the weather, but it's really important not to do that. Next slide. So if you develop symptoms, you need to stay home and stay away from other people, especially your family. Most of the transmission in the community is in households who aren't able to stay apart from each other. So stay home and stay quarantined in your house too. Most people who get it can recover without significant medical care. So don't leave unless you feel like you need to go to the hospital or to your doctor. Get rest, take care of yourself, stay hydrated. Tylenol really helps, and just staying under cover until you are feeling better. Stay in touch with your doctor. If you get trouble breathing, severe pain, throwing up, can't keep any fluids down, feel dizzy, then you might need to touch base with your doctor or go to the hospital. And again, as much as possible, stay quarantined in a specific room and use a different bathroom from your family if you can. And then monitor your symptoms. Next slide. The warning signs of COVID. So especially trouble breathing. COVID affects your lungs. And the most significant complication is having to go on a ventilator from low oxygen levels, and trouble breathing. If you get pain or pressure in your chest, if you're confused or your family knows you're confused, if you can't stay awake, or if you're turning blue, those are all emergency warning signs and you need to go to the hospital right away. Of course, this is not all the possible symptoms, so please talk to your medical provider if you have other symptoms that are concerning. And call 911 or call ahead to your local emergency facility if you're really feeling sick or having trouble breathing or any of those other emergency warning signs. Next slide. So COVID-19 versus flu. They're both contagious respiratory illnesses, but they have different viruses as shown on the slide there. COVID-19 is spread more easily than the flu, and it causes more serious illness in some people. It can also take longer to show symptoms. Flu generally has a shorter period before people get sick from when they show symptoms. It can take up to 5 days for people with COVID to show symptoms, or some people don't show any symptoms at all. Another key difference is that there's a vaccine to protect against the flu. And we're very close to a vaccine, we hope, but the best way right now to prevent infection is to avoid being exposed to the virus. Next slide. So similarities, you can see the list of similarities there. One thing that COVID-19 seems to have that the flu doesn't is that it can include a change in or loss of taste or smell. That's an important COVID symptom. I talked about the latency period there, and COVID-19 can be spread more easily. The risk of complications for healthy kids is higher for flu compared to COVID-19, but COVID-19 can cause serious medical problems in kids as well. And some of the other complications we've seen with COVID-19 includes blood clots in the lungs, in the heart, in the legs, or in the brain. And then kids can get this thing called multisystem inflammatory syndrome in children, or MIS-C, which is pretty serious. Next slide. Flu shot's always important. It's especially flu this year. You can get COVID and flu at the same time. And flu can cause serious illness, and we see a bump in hospitalizations when the flu season is here. So if we have a bad flu season this year, our healthcare system is really going to be stretched. So please, everybody who can get a flu shot, please do, because that'll both prevent you from getting flu and COVID at the same time, and it'll save our healthcare system from being overwhelmed with both infections at the same time. Next slide. So mom's upset because she got an 82 on my science test. I'm not sure I did that well on my kid's science test. There's a couple other, and I never let my hair get that long. I'm not sure it will grow that long anymore. Next slide. All right, that's it for me, except for questions. Thanks everybody for participating.
Thank you, Dr. Mikowitz and Dr. Whitley, for your insight, of course. I'll now do my best to get our three speakers through the Q&A portion. We've got about 15 minutes. We've got a range and a host of questions. And we thank everybody who submitted questions. We hope to try to get to them all if we can. First question, I know it's not possible, this is for Dr. Newell. I know it's not possible to test every person in Santa Cruz County for COVID-19. So this makes me wonder how accurate our positivity numbers really are.
That's a great question, and you'll notice on our website that we specify that that's the number of known cases. And early in the pandemic, the CDC told us to multiply by a factor of 20 to 30 to get the true number, but that was when testing was very rare and we had to get the permission of the CDC to actually run those tests. Now it's probably a factor of less than 10. But for example, right now our website shows 600 active cases in the county. Those are cases reported in the last 14 days, but it's probably well beyond that. And there are still some areas of testing where folks have a very difficult time accessing testing. Very good.
A question for Dr. Mikowitz. Are elective surgeries and other hospital-based procedures safe? An extension of that is, does Dominican have the staff and equipment to adequately care for Santa Cruz?
Yes, actually, we watch this every single day. We review the number of patients in the hospital. We talk about how much PPE and staffing, and I'm very confident that it is safe to have procedures here at the hospital. That said, if we do have a surge or we don't have ICU beds and we need to step back, we're prepared to do so in collaboration with Dr. Newell in the public health arena. But at this point in time, we are doing very well, and we're very fortunate to have the staff members that we do and the physicians who are working hard and keeping themselves safe.
Good. So a question for Dr. Whitley. I have an elderly parent with modest dementia issues. If they have a need for emergency care other than COVID related, what's the protocol for bringing someone to the ED and staying with them throughout their stay?
So we are screening all patients in the emergency department at the front door for COVID symptoms. If people have COVID symptoms, they're directed to our COVID area. And if they don't, they're directed to an opposite area. So they're kept apart from the beginning. And then depending on the patient's symptoms and vital signs, they'll go to the appropriate area of the emergency department. Anybody who has who needs assistance when they're a patient can have a family member with them at all times. That's one of the criteria for having a visitor, is if people need assistance.
Very good. Dr. Newell, how will the vaccines, Pfizer, Moderna, including with the 94.5 effective rate, change the game? Will the community eventually be asked to get a COVID shot similar to a flu shot as the virus mutates?
We just don't know very much yet about how the vaccine's going to change things. We're very excited about the 2 clinical trials that have shown over 90% effectiveness, because we were hoping for an effectiveness around 60%. But this is only over a 2-month period, so we don't know long-term how that immunity is going to last. And it may be that we do need to get a new vaccine every year like we do with flu. Probably this coronavirus is with us in the human species for a long time to come. It's probably not ever going to be over with, certainly in our lifetime. And then vaccine availability for the general public will probably be a full year from now before it's readily available for everyone. So we can continue to live with these social distancing requirements for the coming year.
Very good. Can you, Dr. Newell, again, a lot of public health type questions, which are excellent. Can you please expand on the increase in pediatric COVID cases?
We really saw a big jump in these after Halloween, and they do seem to be related to Halloween social events. We have a few schools, private schools, that are open. 14 private schools opened when we were 2 weeks in the red tier at the end of September, and they have done very well. We've had just a handful of cases in students and teachers and no outbreaks at all. So we don't think it's from the schools. We think it's from social events, particularly around the holidays.
Another question, in the Daily Mercury News, the San Jose Mercury News graphic, it shows Santa Cruz has 0 per 1,000 testing. I'm not sure if I got that question right, but that's the language was used.
I'm not familiar with the Daily Mercury News and their graph, but we are doing better than the state average for testing, which has enabled us to adjust our case rate down week after week. So we're not as good as Santa Clara or San Francisco, who have about 600 tests per 1,000 population. We're running about 300, but that's still a lot.
I think this one is either for Dr. Mikowitz or Dr. Newell regarding flattening the curve for hospitalization. How many COVID hospitalizations do we have today, perhaps in our county, but perhaps here at Dominican, and how many of those are in the ICU?
I can certainly share for Dominican. We are averaging between 5 and 10 COVID patients in the hospital. Our peak was 13, And today, I think I can safely share we have 10, and 5 of those are in the intensive care unit. That said, these patients are being admitted and discharged fairly quickly. We have had, I think something like 8 discharges over the weekend. So we're taking care of people. Those who get better, we are able to discharge. I don't know where Watsonville Community Hospital lies at this time.
I can tell you that Watsonville reports today 4 total COVID patients in-house, 1 in the ICU. So we have lots of hospital capacity and ICU capacity in our county.
Very good. Do we have any information on monoclonal antibody availability here in Santa Cruz?
We do. We are part of the state distribution process, and we will be getting, as will the rest of the counties in California, our allotment this week.
Very good. And then for Dr. Mikowitz and Dr. Whitley, from Tracy Saraleaf, what support do you need from community business leaders like local manufacturers and innovators do you foresee this winter?
Well, I'll start and then I'll let Dr. Whitley jump in. I think we've been very fortunate that the local business and manufacturing teams have stepped up. Early on, we had, as I mentioned before, multiple face shields that were developed. The 3D printers were working very fast and furiously in Santa Cruz County, and the folks who have put together the plexiglass to separate our staff members and people and keeping people safe as another barrier has been really appreciated. Even the folks who made the stickers for the floor so that we knew that where 6 feet were. So I think we have been blessed. I can't think of anything more we need right now, but I'm not very innovative. So I'll see if Dr. Whitley has an idea.
I think the business community has been incredibly supportive, and we at the hospital, I mean, our staff really, really, really appreciate all the outpouring of support we had at the beginning of the pandemic, and that continues now. I think, you know, besides that support, just being role models for your employees and for your partners, and wear your mask, and you know, don't have large gatherings, meet virtually whenever you can. Just model the behavior so we can flatten the curve again and stretch it out until we get that immunity from a vaccine that we're looking for.
We have a question regarding reaching out to our Hispanic and our South County population. Are there some specific things that we'll be doing to reach out to that population, Dr. Newell?
Yes, from the very beginning, when we started our Department Operations Center in Public Health, one of our objectives was to use that equity lens and make sure that our South County partners in particular were looped in. The state has now made that a requirement that we invest a proportional amount of our resources, both economic and otherwise, to those areas that I showed on the maps, the blue areas, so our most vulnerable populations. And we've been working with Pajaro Valley Group in the South County, meeting with them almost on a daily basis, and they've received the bulk of our funds for media and messaging to message to their South County community in a way that is culturally appropriate and linguistically competent. So we're very proud of those efforts.
Very good. Christina Belleville asked, is there a scenario which would lead Santa Cruz County or the governor to issue a shelter in place such as the one earlier in the pandemic?
Well, I think that's today. The governor on Friday, or the state on Friday, released some pretty strict travel guidance and some gathering guidance in anticipation of Thanksgiving. And today, with the dial back applying the emergency brake, there's a stricter face covering order, and most of the state is purple. So we're definitely moving into more restrictions. And if those don't work, then the governor is ready to do more. And
our friend Dr. Patty Kubo-Lezen asks, where can the general population of Santa Cruz get rapid testing without a physician's order?
Right now, there's one easy place, and that's at Ramsey Park through OptumServe. There's a website that you can sign up on, but you can also just walk in at Ramsey Park. The testing currently is 5 days a week, Wednesday through Sunday, but soon it will be 7 days a week, and we'll be getting a second site in Santa Cruz proper, and these are free, and you just walk in or sign up, and you don't need a physician order. They're state run.
Okay. Dr. Mikowitz and or Dr. Whitley, are hospital workers able to be tested similar to testing for nursing facility staff? In other words, can they get a test whenever they need it?
Well, if they're symptomatic, they certainly should be reporting to employee health, and we are using our rapid test so that we can give them a result quickly for the symptomatic individuals. And now that we have gotten everybody received a flu shot at the hospital, which was taking up a lot of our time for employee health, we are expanding access to testing. And for Dominican, you should watch for the announcements coming out of employee health in our weekly newsletter to let you know what days. We have had some targeted testing of different departments, and we're hopeful that we'll be able to spread it further. We did probably about 2 months ago now have more expanded testing, but we quickly overwhelmed the company that was doing our testing, and so we had to pull back. Now that we now have the BD Max, the Cepheid, the site that Common Spirits put together in Arizona, and our Stockton site, we are looking to expand that testing. Dr. Whitley, anything I left out?
No, that was perfect.
Dr. Newell, is there any data or information related to the percentage of COVID carriers that are asymptomatic, as in those that never develop symptoms? And then I guess the follow-up, how accurate are COVID antibody tests?
Yes, there's growing data around how many patients are asymptomatic. Most children are asymptomatic. At least 60% of the time, children are completely asymptomatic, and about 40% of the time for adults. And then the question about antibody testing, we believe that it's fairly accurate, especially if it's done with one of the tests that's got the emergency use authorization by the FDA. So if you're interested in getting antibody tested, it's a blood draw and or a blood test. And you should look on the FDA website. It's pretty easy to do. Just Google FDA EUA antibody testing. EUA is experimental use authorization. There's about 3 dozen tests that are approved. And the problem is we just don't know what it means, because we don't know how long those antibodies last or how good they really are at protecting a person against disease. But if you're curious about whether you've already had COVID, that's the way to get your answer.
Excellent. We have time, I think, for one more question. With the new purple tier, what will happen to our local public schools? Is a hybrid model still possible to go live in January?
At this point, the only way for a hybrid model to open under purple tier is to get a waiver, and waivers are only available for kindergarten through 6th grade or pre-K through 6th grade. And that's because children in elementary school are at lower risk of COVID and having COVID sequelae or problems from the COVID, and less likely to spread it as well. But the state may put a hold on approving waivers. And so we're still waiting to hear what the state is thinking about that in light of this surge.
Okay. Well, we will now conclude our town hall. I want to thank our 3 presenters, Dr. Gail Newell, Dr. Nanette Mikowitz, and Dr. Greg Whitley. We appreciate you all very, very much and taking the time today. If your question wasn't answered, please feel free to email us at norcal.online marcom@dignityhealth.org, norcal.marcom@dignityhealth.org. We'll try to answer those questions that we did not get to. Also recall that we have recorded this. We'll be making this available to the public and for you to review as well, all those that have been on with us. We've had over 200 people join us, which we're grateful for. And before we sign off, I invite you to please check out our foundation's virtual event this Friday at 6 p.m. We're recognizing the fantastic work that we've done here over the last couple of years at Dominican Hospital for an insider look at how private support ensures the best possible care for our community. The easiest way to register for this free and wonderful event is to go to www.supportdominican.org. Thank you for your time and be well. Peace.